The failure to provide accurate public health information, including the efficacy of vaccines and the accessibility of them to people across the country, including South Carolina, is literally killing people. So maybe they should consider that.
There's still pushback about the president's comments about going door to door to encourage vaccinations.
Now we need to go to community by community, neighborhood by neighborhood, and oftentimes door to door, literally knocking on doors to get help to the remaining people protected from the virus.
The South Carolina governor said today that enticing, coercing, intimidating, mandating, or pressuring anyone to take the vaccine is a bad policy that will deteriorate the public trust and confidence in the state's efforts. And Governor McMaster said he's going to prohibit the state health agency from using the administration's targeted tactics. Can you respond to the governor and explain what it is that is being done and what is not being done in this outreach?
Sure. Well, let me first say that the failure to provide accurate public health information, including the efficacy of vaccines and the accessibility of them to people across the country, including South Carolina, is literally killing people. So maybe they should consider that. But I would say that what this is and what it is not, this is not federal employees going door to door. This is grassroots volunteers. This is members of the clergy. These are volunteers who believe that people across the country, especially in low vaccinated areas, should have accurate information, should have information about where they can get vaccinated, where they can save their own lives and their neighbors' lives and their family members' lives. That's exactly what this is. It's something that's been going on since April, and it's something where we've seen an impact in states where there are lower vaccination rates. So it is something we will continue to work with local groups to do, and it's a disservice to the country and to the people who may lose their lives, who may lose family members, to provide inaccurate disinformation at a moment where we're still fighting a pandemic.
If we do get surges, they're going to be regional among those areas of the country where the level of vaccination is low. We still have some areas of the country where the percent of vaccinated people is like 30%, which is very, very low. We've got to get it up above that. Otherwise, people in those particular locations are going to wind up having a higher degree of risk of infection, and you're going to see more infections and more hospitalizations, and unfortunately, in some cases, maybe even increase in deaths.